Oh. Oh, look at that. Tongue is awful. Dates gone wrong, sketchy medical practices, and lots of things that go boom. Grab your popcorn and hopefully learn a little, because today, in honor of the new Transformers movie, Rise of the Beast, coming out, we are breaking down and reacting to all of the over-the-top medical scenes and wild injuries from Transformers. Let's dive right in. Oh. Oh, look at that. Tongue is awful.
The biggest tongue in the world.
A tongue doesn't naturally come out that far. Obviously, this is a Decepticon, the ability to stick your tongue to your nose. That is called Gorlin sign. Some people in the population are able to do it and some are not. Oh, a little strangulation. Getting strangled, right? So two different mechanisms are occurring. One, you're having compression to the airway itself, which is cartilage. The other mechanism is cutting off blood supply going up and down out of your brain. Oh. Flowing around the room and getting posterior head trauma. If you get hit in the back of your head where your optic nerves actually come in, it can actually mess with your vision. And then obviously you can cause skull fracture and intracranial bleeding, as well as a coup counter coup bruising injury to your brain. An explosion like that's going to cause compressive type injuries to people who may not have direct hit or contact with that blast, but are around it from the pressure. We worry about ruptured tympanic membranes or your eardrums. We worry about rupture of your lungs, which would cause like a pneumothorax.
Look, it's above you! Run!
So cool. Oh, what was that?
What the hell was that?
All this tissue is gone. You don't get burned that fast. People who get cremated go into these containers that the heat gets so high. Even then, you're still having small pieces of bone that actually don't break down.
Come on, get in, let's go.
You're seeing all this stuff coming down out of the sky. You gotta be careful with that stuff because it could be on fire. It could still be super hot and cause burns when it actually touches your skin. It might cause first degree or second degree burn. He is forced down on a table. His arms are restrained. We do use some restraints in the hospital when people are agitated, but we try to get them out of those restraints quickly because we know that they potentially can increase the risk of causing rhabdomyolysis. Oh. Up the nose. We actually use something called a nasal speculum that we use to look up somebody's nose and shine lots of lights in there to take a look in. We don't have these type of instruments. Oh, geez. He's not really being held down well. He's being held down by his wrist. Could actually cause a fracture the way that they're holding it. Sometimes, say, a confused elderly woman or man comes in, we'll actually use a type of chair that has like a nice table for them, but they can't move the table, but this way they feel more comfortable instead of just restraining somebody. Oh, nasty looking thing. Open in the mouth. Oh my gosh. Oh, I would be gagging and vomiting. People have a gag reflex. Basically, if something hits your uvula, which is the punching bag in the back of your throat, or your tonsils, or the posterior pharynx, which is the back part of your mouth, it can cause you to gag and try to cough it out. That way, things don't go down that aren't supposed to. So it went into his mouth, but is now coming out his nasopharynx. So it's in the back part.
It's in the back.
Okay.
Lead us to the Energon source.
It went in, it went out. It's trying to get data from his brain, but there's something called your cribriform plate, which is at the base, preventing your brain from just falling out. It's a bone on the bottom. Sometimes you can have cribriform plate fractures where you have CSF coming out of your nose.
Brain?
Oh, Wow. So they were going to try to cut open his brain.
Oh no, my brains.
Wouldn't be good because it's not a sterile situation. Typically, you would be sedated, you would not be awake. Brain surgery. Most common is a meningioma, a tumor. A lot of times they are in the frontal lobe, so the only way to access them is to cut in the front. Whoa, nice. Run! Whoa! Whoa, 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 whoa. Those compressive forces that are throwing you through the air, you have whiplash injuries, you can have a cervical spine strain, you can have muscle strains, and gosh, he landed like perfectly. But you can land on your head, snap your neck, you can land on any extremity, and if it's not in the right position, you can snap it or dislocate it pretty easy. Okay, so no, that is not how you randomly do chest compressions. And it's really hard to do on a bad surface. You really want to have somebody on a good surface so you can actually have the force of your compressions go on like something hard underneath them. Thinking about doing 100 compressions per minute and making sure that you push down and have enough time for recoil. Typically, if you have somebody that is there that has an ambu bag and is medically trained, then you can do it without interrupting chest compressions, so you can be breathing for that individual, versus you actually can trade off, but you don't want to trade off like mid-cycle. You want the least amount of interruptions of CPR as possible. Okay, so they use the paddles. You're putting it on the right side chest, left flank, because you want the energy going through. You charge the machine, it takes maybe 5 to 10 seconds. You continue to do CPR while you're charging, and then right before you hit the button, you say, clear! That way nobody's touching the patient. Yeah, you wouldn't look, listen, feel at that moment. You continue to do CPR. Sometimes the heart needs to be shocked and then told how to beat, basically, and that's why you're beating it forward, and then hopefully it kicks into rhythm. So doing it again, continuing. You know, at this point, these are medics. They probably should be intubating, putting an endotracheal tube or a breathing tube in, or at least doing a bagged valve mask, airway. You know, this is a healthy individual, probably has a good 5 to 8 minutes of oxygen before it desats below 90%. But you need to get in there.
I love you.
Oh, all of a sudden, okay, because of the awesomeness of the Transformers. Typically, people don't bounce up right away like that. In situations where you need to do CPR, the person's been down for a little while, they're still sleeping and not with it, and they'll be very confused. They won't have the amount of energy that he is having. This is good, Transformers. I am a fan of Transformers. If you guys enjoyed this, please let me know in the comments. Let me know if you want to see more live action movies. We will do them all. Definitely check out this playlist right here. And as always, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.